Hi, I'm David Klein, an orthopedic surgeon from Kennedy White Orthopaedics in Sarasota. In this orthopedic moment, I'd like to talk to you about the basics of postoperative care after your hand surgery. First of all, after the surgery, you probably have some numbness from the local anesthesia that's used at the time of the surgery. Later on in the day, sometimes many hours or even into the next day, your hand will wake up and you will have pain. It's important to fill the prescription that was given to you so that you can take some medication when the numbing medicine wears off. We recommend taking some numbing medicine when you start to get back light touch sensation and not really waiting until it completely hurts. Another thing, if you're going to go to sleep at night and you still have numbness in your hand, take at least one pain pill then. So that way, if the numbing medicine wears off in the middle of the night, you have some medication on board for when you have pain. Also, unless you've been instructed differently, keep your dressing on for 5 days so that it stays clean and dry. At the end of 5 days, we instruct our patients to take the dressings off, and at that point, they can start washing the incision site with soap and water and then replacing a dry dressing daily or as needed. One thing that's really important is to keep your hand elevated all the time. There's often swelling that happens after surgery. The best way to control the swelling is through elevation of your hand. The other thing, unless you've been told not to move your fingers, and most of the time when we don't want them to move, we will splint them straight so you can't move them, is that you really need to keep your hand moving and make a full extension into a flat palm and then make a flat fist afterwards. And do this many times a day, in fact, all day long. In that way, both keeping your hand elevated and opening and closing your fist works like a kind of pump to pump the fluid out of your hand. Another thing that will help control your swelling, other than elevation and moving your fingers, is to unwrap and loosely rewrap your dressing if your hand swells too much and feels too tight. Many people like to use ice after surgery. It works really well for pain, but it doesn't work all that well to reduce swelling. Also, some people think that ibuprofen or other non-steroidal anti-inflammatories will reduce swelling. It does for certain diseases, but usually not for surgical swelling. So, most important, elevation, motion, and unwrap and rewrap your dressing if necessary. Make sure that you call if you have any questions, and we'll be looking forward to seeing you after your surgery in the office.